Good morning. Thank you so much for asking me to share information that I originally provided with Dr. Mary Jo Snyder as part of the Kalamazoo Leadership Team presentation in February of 2016. The information that we provided was about burnout and resiliency, and it was specifically in response to a speaker who came to us at the leadership retreat back in October of 2015. And the feedback that came back from that retreat, which again formal leaders attended, is that they wanted more information about specific strategies to help prevent burnout and to build resiliency for individuals and for teams. So hopefully the content that I'll be providing in the next several minutes will help give you some of those tools. This quote by Chester Elton I think is powerful because it states that the patient experience can never be better than the employee experience. That gives me pause as a physician, and also as a teammate in the very complex world of healthcare. I'm sorry, I should introduce myself. My name is Elizabeth Warner. I'm a primary care internist that's been part of Bronson since I graduated from residency in 2001, and I now serve as the medical director for continuous improvement support. So as I think about how we can improve the employee experience, my team's experience, so that ultimately the patient can have the best experience here at Bronson, you can't really have that conversation, in healthcare certainly, without talking about burnout. The definition of burnout is variable, and they're listed here on this. 3 of them are listed here on this slide. This is not an exhaustive slide. And they read things like a chronic disease of disengagement. If we think about the chronic disease of congestive heart failure or diabetes, we can realize the significant implications of it. Chronic is an important part of that definition because while it can occur, burnout can occur suddenly after trauma, it typically is a slow, insidious set of symptoms that lead us to significant disengagement and lack of efficacy in our work. Another definition of burnout is progressive loss of idealism, energy, and purpose. And we're going to split those out and talk through those in a few minutes. And then the definition that Paula Davis Locke gave us back in October of 2015 is the last one listed on this slide, where burnout is a work-related chronic condition of too many work demands, too few work resources, without sufficient recovery time. So it's sort of a 3-pronged piece. So too much work demand, not enough resources to do your job, and not enough recovery time. This is different than stress, because with stress, you can cope with that stress in a short amount of time, rest, recover, sleep, wake up the next day, and you're ready to go. But with burnout, there's never enough time, there's never enough rest, there's never a long enough vacation to really get you back to full functioning. So some folks will ask, is it really a big deal in healthcare? I'm actually hopeful that some of you will think that because then you haven't been affected by burnout. But the reality is it's a huge problem in healthcare and clearly only getting worse. The stats that are listed on this slide really just show the extent of the problem of burnout in healthcare with specific job titles such as medical students, physicians, and nurses. But I think any of the stats listed here could be reflective of anybody who's in the service field of healthcare, regardless of their job title. The problem can have staggering implications, including suicidal ideation, suicide completion, substance abuse, automobile accidents, marital and family discord, and others. And if you've never known anyone to leave the healthcare profession because of burnout or to harm themselves because of burnout, then you're lucky. I've had 2 physicians that I've known in my career who have chosen to kill themselves rather than continue in this life. And I have a hard time believing that burnout was not a part of their decision. When we think about burnout, I like to think about it in terms of a negative energy balance. And when we're thinking about an account or a tank, we can think about the tank of a car, the gas tank of a car. And there's 3 different energy accounts that are either full or empty with the concepts of burnout. The first is your physical energy account. And if your physical energy account is low or empty with burnout, then you're going to experience the symptom of exhaustion. And this isn't just, oh, I feel tired today because I slept badly. This is, I can't lift my head up off the pillow. I can't bear the thought of slogging my way through another day of work or another day of life, because burnout doesn't stop when the workday ends. Another energy account to think about is an emotional energy account. And when that account is empty, then the symptoms of cynicism, sarcasm, compassion fatigue, and lack of empathy are typically the symptoms that emerge. This is probably the most destructive symptom of burnout because it can be clouded in the concept of venting. And venting's a good thing, right? We can blow off a little steam and get back to work. But it actually turns out when you're practicing behaviors that reinforce compassion fatigue and reinforce cynicism and cynical behavior, it's actually incredibly destructive, both for the individual, for the interpersonal interactions, and for the team. And to me, that's a huge sign of burnout. The third energy account is one called the spiritual energy account. And this may or may not have anything to do with religion for you. In this context, I mean it in a non-religious fashion, where the spiritual account is about your connection to purpose. So when your spiritual energy account is empty, people will often think, why bother? What's the point of going to work? Whatever I do doesn't matter. And that can be incredibly destructive for the internal fire and the light for the person within. And what we want to do in burnout is to be able to increase and build up those energy reserves in all of those accounts so that you can move from surviving to thriving in your entire life, but certainly within your work as well. The metaphor of a tennis ball for resilience is a very effective one. I'm smiling right now because when I presented this at KLT, I was bouncing the tennis ball trying to give the example of resiliency as a bounce back. And it's not a partial bounce back of energy, but a full bounce back all the way back into your hand with the tennis ball. Of course, when I taught this at KLT, I also wound up bouncing the tennis ball, losing control of it, hitting my head, and having it roll across the stage. So you can see that resiliency also has a bit of playfulness and a sense of spirit and energy to it. As we think about resiliency and building resiliency, because it's not something that you have or don't have, it's actually something that you build and that you practice. The crucial component that everyone needs to understand in terms of building resiliency is you cannot give to someone else what you are not giving yourself. So when you see the slide with the flight attendant and she's holding that thing where she says something like, he or she says something like, in the unlikely event that the cabin loses pressure, oxygen masks will appear. And the next thing he or she says is, please secure your mask before aiding others. So we need to secure our own masks in terms of being strong and resilient before we were able to fully give to our patients, to our teams, and to our internal customers. I love this slide with the 5 circles in it. And if you look at this rainbow of circles, you're going to see 5 words. And we're going to hit them each today in the next about 15 minutes that we're together. And if you start at the top, you'll read self-aware, mindfulness, purpose, self-care, and relationships. I'm not going to do them in order, but I am going to hit all 5 of them. Self-awareness is a crucial component to resiliency because most folks who are burned out, they don't become aware of how fried they are until they're pretty far down the path of symptoms. So if you see a wildly disruptive colleague, they're pretty far down the line of burnout, and they have lost their ability to be self-aware of their behavior, their surroundings, and their impact. The metaphor of a mirror in the slide is important because if you're holding a mirror up to yourself, if it's a clear and unclouded mirror, you can see. But most of us are looking through a mirror that's either smeared or clouded or covered with film, or potentially looks more like a funhouse mirror where it's been distorted and wavy and it's very difficult to interpret what you're seeing. So self-awareness is often a personal effort, but it often also requires feedback from loved and trusted colleagues and family members so that you can sort of spot check, is my mirror distorted? Am I seeing this interaction or my behavior clearly? And the next thing that we're going to be talking about is mindfulness, which actually allows you to be much more self-aware in your day-to-day dealings. So the slide about mindfulness is really just to remember mindfulness is 2 very simple things, and it's an absolute treasure to be able to do this work. And so it's really important. So you got to pick up that pencil and write these down because it's really important. Okay, so mindfulness is 2 things. It's being fully present in this moment, which sounds really easy, but it's not. And the second piece is, and to do it without judgment of yourself and others. That's the hard one, if you can actually get present in the present moment. But there's a practice we're going to go through that hopefully will make this a little bit easier. And even if you're able to practice being mindful for 1 second more than you were yesterday, that will give you benefit and you can continue to build upon that practice. Now, if this is starting to feel fluffy and this is too new agey for you, I'm going to tell you there's very good science behind this. And I can also tell you personally, it absolutely revolutionized my primary care practice. I was a fully functioning, happy, resilient physician. And there's no question that a lot of it was because of the habits that I developed. Probably not as deliberately as I'm trying to deliver today, but that I developed throughout my time as a primary care provider. There's good evidence. John Kabat-Zinn in Boston, Andrew Weil and his work with integrative medicine, Oprah Winfrey. I mean, who else knows better than Oprah Winfrey? And a lot of the teachings of all the different branches of yoga would really show that this mindfulness strategy is good both for mind and for body. So you see a circle with 5 steps to develop a mindful moment. And we're going to start at the 12 o'clock, which is step 1, or regrouping. In step 1 in regrouping, all you're trying to do is bring your awareness back to the present moment. And it sounds very simple, but it's actually incredibly difficult, especially in American culture, because we are constantly bombarded with stimuli. Even if we don't have our cell phone attached to us and vibrating and doing all sorts of craziness, we have all sorts of noises and sounds that are distracting us. We also believe in the myth of multitasking, and I mean that deliberately. It is a myth that human beings can multitask. To remind myself of this, I actually have this coaster. Okay, so it just reads multitasking, screwing up several things at once. And it reminds me, as it sits on my desk, sits on my computer every day, that, you know what, be present in this moment now, so that you can actually be most effective in this moment now. So regrouping typically requires some type of trigger, and you may need to reflect a little bit on when during the day you most need to regroup. One example for me was before I entered every exam room when I was a primary care provider. I knocked, and I would knock on the door, and then I would enter. But before I knocked, that was my trigger, my body trigger to actually stop and regroup. And I would tell myself, be present with this patient now. And then I would knock, and I would go in. And right after I started that practice, I was more fully aware. I was picking up much more information and subtext with my patients, and actually better able to listen and give better care as a result of that. Another strategy that I started doing was when I transitioned from work to home. I have two boys, and when I would pick them up from work, and they'd be chattering away, and I'd be thinking about dinner and everything else I needed to get done that night, and I would find myself really clenching on the steering wheel. So before I would put it into reverse to back out of wherever I was picking the kids up, I would take a moment before shifting. I would take a moment and take a breath and say, be here now. You're now transitioning from work to home. And then I'd put it in reverse and move on with my day. I wasn't always a success. I am not always as successful at that in transitioning to home, but it's certainly a practice that's helped me try to be present in that moment. So that for you, there may be different cues during your day to regroup. It may be when you come back from lunch. It may be when you're washing your hands, right? So as you're washing your hands, you say, I am here right now, touching my hands. I feel this, so I am present in this moment now. And that's all you do with regroup. Staying in that moment is actually what we're going to be talking about next. So in the second step, called release, or with the 5 R's that we're walking through, that release means to let go of distractions. That is incredibly hard because, again, we've got all these messages, both internally and externally, that are sort of bombarding us. But that release effort is so that you can you can let go of anything that's distracting you or taking you away from the present moment. And the way to do that is to not say, okay, I'm not thinking of anything else. I'm not thinking of anything else, because of course that'll make you think of something else. But it's to notice the thought, the intrusive thought, noise, sensation. Say thank you and let it go. The trick with release is to catch and release rather than to catch and hang on, right? So that release is a very deliberate mental practice to do. So if you think about what those distracting thoughts or worries that you might have that come into your day, you can use the regroup of I am present now. And as an intrusive thought comes in, say thank you and let it go. And we're going to practice all these in just a moment. Now remember, that never means your brain is empty, because our brains are never empty. So that release thing you're going to do all the time. You're going to do it over and over and over and over and over again. That doesn't make you wrong. That just makes you human. All right, so that's totally normal. The third step is called rebalancing. And it's for me, it's probably the hardest. And rebalancing means that you're releasing judgment. And that means releasing judgment of yourself and others. And maybe you don't do this, and kudos to you if you don't. But very often the inner critic in our head is incredibly noisy, incredibly chattery, and casting judgments upon everyone and everything all day long. And as we get more connected with the present moment, and we hear that distracting thought, and we let it go, if there's a judgment that's attached to it, or the judgment comes after it, that too you must practice letting go of. Because remember, being mindful is present, here and now, present in the moment, without judgment of self and others. And this step will get you there. And it may take you thousands and thousands of releasing and rebalancing cycles to quiet that inner critic voice, and then do it again the next day. And that's okay. That inner critic is intended to be there cognitively as a protection for us, but it's actually more of a distraction now in our lives. So to put this all together, I'm going to ask us to do something. I'm going to ask us to do a very deliberate breathing technique that will allow us to practice mindfulness. I'm not calling it meditation. Some people do. When I describe these concepts to people who practice yoga, they're like, oh yeah, I totally get this. This is how we do our breathing in and out as it relates to the poses. And those things are great. Some people do this with prayer. All of those avenues of getting to a mindful moment are fantastic. I'm just going to teach you another one, and you can decide if it works for you. So the way we do this is by following those R's. So we want to regroup, right? So you're going to get your feet on the ground, uncross, both feet on the ground. Get your spine straight and comfortable. Some folks will choose to recline. Some folks will choose to sit up. And put your hands in a comfortable place. For most people, it's not like this. But if it is, that's okay. I like to keep my hands crossed like this. I like to feel the connection. And then I have them sit comfortably in my lap. All right? So if we feel our feet on the ground, and we know we're here now, feet on the ground. Now, we're going to release any thoughts that come in. And we're going to do this by focusing on our breath. To focus on our breath, we're going to breathe in for 7, we're going to hold for 4, and we're going to exhale for 8. All right? So if we're focusing on our breathing, then anything that's not focusing on breathing would be considered a distraction, and we'll just practice saying thank you and releasing it. And the next noise that might come is some judgment upon yourself or others, which you would say thank you and release. And just keep returning to the breath. The hardest part about this is we can't breathe the way we usually breathe throughout the day doing this exercise, because we usually breathe like this, maybe a little slower. But to be able to breathe in for 7, you're really going to have to belly breathe, okay? So adjust your pants if you need to, and know that your chest is going to rise, your belly is going to expand, and you're going to exhale it out. I'm going to do the count, but if your counting is a little bit different, that's fine. If you can't hold it for as long, that's fine. You want to find a position that's and a breathing pace that's comfortable for you. Okay. The first thing that I'm going to do is I'm going to model the breathing, and I'm going to also be telling you what I'm thinking on the inside, so you can see the inside of me while I'm doing this breathing. All right. So it looks something like this. I feel my feet on the floor. My spine is straight. And I'm going to start breathing in. I wonder how weird I look. Do my eyelids look funny? That the camera actually adds 10 pounds? Oh my God. Did I really just think that? Are you serious? You can't even breathe one breath in front of everybody else? Okay, try again. I almost made it. Cool. What is that noise? Okay, so it's totally normal that we all do that. The conversation in our head is going all the time. And you just release what you hear and try and meet your thoughts with loving kindness. You practice loving kindness to yourself, you're much more able to practice that same loving kindness to others. So now I'm going to do it. We're all going to do it together. Now I close my eyes. That is a comfort for me. Okay, it just reduces distractions for me. You do not have to close your eyes if you don't want to. You decide. But all I'm going to do is I'm going to count 7 in, count 4 to hold, and exhale 8 out. And we're going to do 3 breaths together. The first 2 I will count. The third I will do in silence. Okay? So find your position. And here we go. Breathe in for 7. Hold for 4. 2, 3, 4. Exhale out for 8. 1, 2, 3, 4, 5, 6, 7, 8. Breathe in for 7. 2, 3, 4, 5, 6, 7. Hold for 4. 2, 3, 4. Exhale for 8. 3, 4, 5, 6, 7, 8. One more in silence. Good. Just take a minute. Just feel. How do you feel on the inside? How do you feel on the outside? Do you think that maybe you could take on, or you could handle the stress of your day just a little bit better from this place than where you were maybe when you started watching this video? You consider it. Try it for yourself. But I can tell you for me, and for millions of people who meditate on a regular basis or practice mindfulness on a regular basis, derive significant efficacy and effectiveness benefits from it. As we go to step 4, which is about refresh, it's about coming back to the world with a beginner's mind. There's a Zen phrase or quote that goes, in the beginner's mind, there are many possibilities, but in the expert's mind, there are but a few. And we want to come to our work, we want to come to our lives with a beginner's mind. And it's much easier to do that, to come from this centered and grounded place that we've just achieved, than from our busy, go, multitasking, distracted state. And that beginner's mind, you don't have to do the first 3 steps to do this. It's easier to, but you don't have to. You could just get to that phrase in your head that says, wait a minute, let me look at this from a beginner's mind. Am I coming at some issue or concern or some challenge in my life with assumptions or judgment or something that's keeping me from seeing all of the potential solutions? And we want to develop an entire army of problem solvers here at Bronson. So we got to have this beginner's mind to get there. The last piece of that circle of R's is the reconnecting. It's reconnecting back with the world. And the reconnection that's probably most tangible in terms of a practice is reconnecting with gratitude. To be able to use gratitude as a reconnection strategy is pretty simple. You stop right now and you think, what thing, what action, what activity, or what person in my life am I grateful for that perhaps I've interacted with in the past 24 to 48 hours? You don't have to do the time limit on it, but I like to because it keeps it fresh for me. And think about it and hang on to that feeling. Write it down, say it, or think it. That gratitude practice that you just did will benefit you. It'll benefit your energy. It'll benefit your life. People with high levels of gratitude, they report higher levels of positive emotions, life satisfaction, optimism, and vitality. And I don't know about you, but I want those things. So practicing gratitude is a great way to get to it. And you can do that anytime. The following quote by Dennis Prager, it's on your slides now, I love, so I'm just going to read it aloud with you. All happy people are grateful. Ungrateful people cannot be happy. We think that being happy leads people to complain. But really complaining leads to people becoming unhappy. So when we talked about the symptom of cynicism and compassion fatigue, back when we talk about burnout, that complaining and venting thing, it's exactly the most dangerous behavior to do if you're trying to seek centeredness, happiness, and joy in your life. There's a whole bunch of ways you can practice gratitude, and many of them are listed on the slide you see here. There's apps for that. There's a photo journal. You can do like a gratitude 30-day challenge where you take a picture of something you're grateful for. You can post it on Facebook. You can have conversations with friends and family. You can buy a gratitude journal. One thing that my family does is when my sons and I sit down for dinner, we actually go around and give gratitudes. So every day we get to hear what each family member is grateful for. And our rule is it's got to be in the past 2 days. So people are really staying aware and mindful of good things that are happening in their lives and keeping that in the front of their brains. And I want to teach my boys to be able to do that for the rest of their life. If we go back to those 5 circles, and we've talked about self-awareness, we've talked about mindfulness, I want to shift to self-care. We're not so good at this in healthcare, and so I'm going to hit this one pretty quickly, but you guys probably know the areas of self-care that need work, and they're so basic, but they're so easily ignored, sometimes all the way since our training. So basic things like food and water and exercise and rest, which is different than sleep. Rest sprinkled throughout your day every 75 to 90 minutes may be something as simple as 3 deep breaths. It may be something as simple as 90 seconds to 2 minutes away and then come back to your work. But those little restful interludes throughout your day can make you incredibly more effective and also improve your energy levels. Sleep should not be ignored. America is chronically underslept. Average human being needs 8.25 hours of sleep per night. That's a human being, right? We can't escape that by being Americans. You probably don't know how much sleep you need because you haven't been able to test that. If you've ever been taking a 2-week vacation, about day 12, that's probably the amount of sleep that you need. When you wake up on day 13 and you're like, oh, I just slept that amount, that's probably about what your body needs. But if you can at least shoot for a minimum of 7, for many folks, that would be a stretch and a huge factor for weight control, energy, efficacy, happiness in your life. And then, of course, practice of gratitude. Because remember, if you don't take care of yourself, you can't take care of others, because you cannot give to others what you're not giving yourself. The 4th component of the circles of relationships is I'm not going to hit that real hard. You may have great relationships here at work, but it's not your entire life. But the point of relationships is it's not that it's any relationship. They need to be high quality, high trust, nurturing, and reciprocal relationships. And so for many folks, that requires reflection. Are there toxic or unhealthy relationships that need to be minimized? Are there folks that you've lost touch with that do meet all of these sort of high connection, high quality criteria for relationships that you need to reconnect with? And if somebody popped into your head of, oh, I need to touch base with that person, write that down, because that relationship is one that you should rekindle for your longevity, your health, and well-being. Remember that humans are wired for connection, and we are not solitary creatures. As human animals, we are wired for connection. So if you found that the busyness of your life has limited your connections and your relationships, take time, deliberate time and practice now to rebuild or build new connections that meet these criteria of high quality relationships. And the last piece is purpose. Again, human beings are wired for purpose greater than themselves, greater than ourselves. And this seems like a no-brainer in healthcare. Well, we know what our purpose is. We're here to give great care to our patients. But unfortunately, in burnout, we lose that sense of purpose. And it is no longer an obvious duh about your purpose. And purpose is greater than your work purpose. You may have a specific purpose that you can define or articulate that is about work. You may have one that you can articulate that's about home. And you may have an overarching one that you can articulate that's about your life. I've always lived with a mission statement kind of rolling around in the back of my head, and I've been very deliberate about articulating that. It allows me to align my behaviors and align my activities both at home and at work in service to this purpose or this mission. And I'm happy to share it with you today. My current iteration of my mission, my sense of purpose is that I believe we can joyously co-create a community promoting the health and well-being of all. And I use that statement to assess my behavior, my intentions, and my actions, and my relationships to see if they line up with that sense of purpose. Now, that hasn't been a permanent, durable mission. It really has evolved throughout my career and throughout my life. The quote by John Gordon, I think, is an important and realistic way to end our conversation together, which is, we don't get burned out by what we do. we get burned out by forgetting why we do it. So if you can practice these strategies and these small little practices that will help build your self-awareness, your mindfulness, reinforce your sense of purpose, affirm and confirm your need for self-care, and the building and strengthening of high-quality relationships that will help you crawl out of the abyss of burnout, if that's where you are. It'll help you lend a helping hand to pull someone else out if you are in a resilient, high-functioning state. And it will allow us to, as a community, to be able to give to ourselves so we can best give to others. Thank you so much, and I wish you the very best.